at one time I was being hit with a lot dealing with lupus. And, a lot of people didn't know because I don't share a whole lot. I share bits and pieces, but people really don't know all of the aspects of what lupus has done.
All right, guys. Well, this is another episode of Terrence Thoughts. Really special episode. Talking about something I'm not familiar with, but I'm open to learn more about, and that is lupus. It's Lupus Awareness Month. And I got my sister here to kind of educate us and give us a little bit more insight. Shaquita Lomac, how you doing?
Doing good, doing good. I'm so glad to be here, excited to share and, just give my insight on a few things. So I'm ready.
Absolutely. Well, you see, I'm rocking the purple, so I had to do it for the coach.
I see. I see. Thank you. I should have put on purple, but Parker wanted to dress alike today, and this is what we had. So got pink, but I got my purple bands on.
Okay, I see you. All right, so let's talk about, before we get into lupus, is there anything you want to share about yourself? Like, what was your life prior to lupus? Were you just a normal college student, or like what happened? Like, just like, what is the whole process before lupus? Like, what was Shaquita like every day? Like,
Okay, so yeah, before I was diagnosed with lupus, just normal. So I thought, but let me see. Yeah, just normal life. Went out, had a good time. Before I was diagnosed, I was newly married, a few months in. And so, yeah, we were trying to live our young, happy lives. And then, boom, had to live out those vows. So,
wow.
yeah.
So how quickly was it? Like, was it, so you, how old were you when you married Dante?
23.
And that's the same year?
I was 23.
And that's the
same year I was diagnosed.
Wow.
Yep.
I know that.
Yeah, so we got married in 2000 and we really got married in 2010. Our wedding day was in March of 2011.
Okay.
And so, but leading up to the diagnosis, I had some issues. But I don't want to get into it if you're not ready. Just whatever questions you got to ask, just go from there. But yeah, leading up to the diagnosis, I had some like joint pain and things like that. But backtracking to college, 2007, 2006. 2006, I was in college at Henderson State in Arkadelphia, and one day I started just kind of feeling really fatigued. I had got a cold, and it took like almost 3 weeks for me to get over the cold, which was really weird because I had a pretty strong immune system, but like it wasn't the flu or anything, and I just kept going back to the nurse's place on campus. And I didn't have anything but a common cold, but it took me 3 weeks, maybe even longer, to finally get over it. And that was the first sign, but I didn't know at the time because I didn't know anything about lupus. But maybe a month or so after that cold was gone, I started having issues with just being really tired every day, all day. Didn't really know why I was tired, but it was just fatigue. No matter how much sleep I got, I was tired. And then I was working at Dollar General in Arkadelphia. They were building a new Dollar General. And I remember me and my friend, we were in there trying to, get the shelf stocked. And I was just like, I'm so weak, and like to where I couldn't even take a few steps without even feeling like I was going to faint. And so my friend drove me back home to Little Rock. I called my mom and told her, I wasn't feeling well. She was like, well, let's get you an appointment, So I went to the adolescence clinic, came home, went to the adolescence clinic in Little Rock. They ran all type of tests and told me that I had mono. So I was like, mono? Okay, didn't even know anything about that. So that's what they told me I had. But I knew that I didn't have mono. When I started looking it up, I was like, I don't have mono, But so a couple of weeks went by to that, still was not better, was not feeling well, started losing weight, no energy. And then I came back home to see a different doctor. My mom made me an appointment with her doctor instead of the adolescents clinic. And so they came back because I had these white sores in my mouth. Um, and they said, well, it's just some type of infection. We don't know what it is. So we're just going to give you antibiotics. I took the antibiotics and I was better, I felt better. And so it was just, that was the end of it. I never experienced any joint pain or anything like that during that time frame. It wasn't until 2010. So like 3 years later, when we started planning our wedding is when I started having the joint pain, the fatigue, all those symptoms just kind of hit me. And even then, my doctor that I had here in Little Rock at the time, she was like, oh, it's probably just stress. Like I was missing work because I was in so much pain, couldn't get out of the bed. Like I said, Dante and I were already married at the time. And so like he would have to like come brush my hair, give me a bath, all those things because I didn't have the strength to, or my joints were hurting. And I knew it was bad when we were in the car one day and I couldn't even let the window down. I couldn't use my finger to push the button to let the window down because my joints were hurting so bad. And so like he would have to buckle me into the car, help me get out the car. Like I said, give me baths, comb my hair, do everything because my hands were hurt so bad. And so I just kept feeling worse and worse. The doctor was like, yeah, it's just stress. It's just stress. And so we started seeing the doctor in like December of 2010. And I got my diagnosis March of 2011. So from December to March, it was just going back and forth. They were trying me on new medicine, just saying, oh, it's probably just stress. So let's just give you like anti-inflammatory medicines. Uh, I started taking like meloxicam just, for my joints and stuff. And so I went to my mom's house one day in early March and I kept telling her like something. I had said, Mama, something just doesn't feel right. I don't know what it is, but something is wrong. And I told her I feel like I was dying because I didn't have energy. I just felt sick. I was in pain all over. And I was at her house and I remember turning around looking at her and she looked at me and was like, you have lupus. And I was just like, what? What is that? And she said it because I
She
had
came out
that
on
butterfly
her own, did
rash.
it?
She said she looked at me with tears in her eyes. I remember, I can see it so clear. She looked at me with tears in her eyes and she was like, you have lupus.
Wow.
And I'm like, I didn't even know what lupus was, but I had the butterfly rash, which is one of the things that lupus patients get, when we're in a flare. It's red right here. Some people actually get an actual rash, but for me, I was just red right here and in this area. So it's, shaped like a butterfly. So, and even now I still get pink, really pink in that area when I'm having an active flare. And so she looked at me and she was like, yeah, you have lupus. And so she called my doctor and said, I want to bring her back in. And when we got there, she said, I want you to test her, for lupus. And my doctor was like, oh, she doesn't have lupus. No way I'm testing her for that. And she was like, yeah, just go ahead and test it. Run all the tests that you can run. Let's just rule it out. If it's not that, then that's fine. But I want to be sure. And so she ran all the tests and she called me back, called me into the office. And I went there and she told me, yeah, your numbers are definitely, looking like lupus. So I'm going to send you to a rheumatologist to confirm it. Sent me to a rheumatologist. And 2 days before our wedding, that's when he said, yes, you have lupus.
Oh my goodness. Wow.
Yep.
So what made your mom, like, did your mom have a medical background and what made her identify?
Yes, yes. At the time, she was in nursing school. And so I think it was kind of fresh on her brain when they had just talked about like, lupus and stuff like that. And so, yeah, she knew exactly what it was. And she went to the doctor with me and the doctor said,
2 days
what's
before the wedding.
wrong? Well, it was 2 days before our actual wedding. And that Friday night, because we were, running around doing all the things, trying to
I
prepare.
was there.
My feet were really swollen. Yeah. You didn't know, did you?
No.
Yeah.
I'm like, this
And
is
that
all new to me.
Friday, yeah, that Friday night, after we got home and got settled and stuff, I was in my mom's house with my aunt and my god sister, and I was in a whole lot of pain. I mean, I think it was just because everything just trying to prepare, for the wedding day. I was in so much pain and I spiked the fever. And I remember them telling us, we went to the rheumatologist that, fever, if you get a fever, you got to go to the emergency room because, it's an infection somewhere, all of these things. And so I spiked the fever that night, and my mom and my aunt and my god sister, we were just kind of like, it's not gonna be a wedding tomorrow. Like, it's not gonna happen because we're gonna have to go to the hospital. And so the fever broke. My mom was praying, and they all came in the room with me, and they prayed, and the fever broke, and I felt, well enough to have the wedding. But the day after, it was over. Like the day after the wedding, I was just so exhausted and beat down. But yeah,
I did not know this. This is wow, this is an epiphany for me.
yeah,
Um, and so, but you guys were married. You already said, yeah, that was just the wedding. So he was already,
mhm,
helping you
yep.
through this process. And wow,
Mhm.
wow.
It was
So
tough though, to just be newly married and
yeah,
then get a diagnosis like, lupus was kind of like, man. And I felt bad because I'm like, who am I about to be a burden? Because we didn't know what to expect. We had no clue. I didn't know anything about lupus. Um, yeah, it was just all new. So we just researched together and learned everything that we could and kind of, navigated through it.
wow. So what are some of those symptoms? Like, what is like for the person out there? Now, I did a little research. Totally ignorant in this area, but apparently it's like 90% women. Am I right?
Yep.
So it's mostly in women.
90% women. Yep.
And it's basically like your immune system is attacking your body and causing these
Yep.
flare ups and stuff like that. So, like, what is like
Yeah.
if it's a female just roaming around, but they're feeling fatigued and stuff? What are some things you would identify? Like,
So,
I had got, I'm sorry, I had got pulmonary embolism. So whenever somebody tell me
mhm,
they have a tight chest or they like every time they breathe they feel something, I'm like, hey, go to the doctor. Just rule it out, but go to the doctor. It's something you
mhm,
want to take seriously. So what are
mhm.
some identifiers you hear when you talk to females that may be
Yeah, so really males and females. I mean, it's the men with lupus too, but you don't see, as many men, or I don't know, I have a cousin that's a male that has lupus as well. But honestly with lupus, everybody's different. I mean, like you said, it is, your immune system attacking the healthy tissues in your body, and with it attacking those healthy tissues, it causes inflammation, and it can be anywhere. Like, I have systemic lupus, so it can attack any part of my body at any time, ranging from my joints to muscles to my brain, my heart, kidneys, liver, lungs. Any part of my body can be attacked. And so that's why, I especially now, and we can get into that later, I try to take it more seriously, when I'm having a flare, because I mean, you never know what part of your system is gonna attack. I don't know if it's attacking my kidneys at this time. I don't know if it's attacking my heart, or or if it's just joint and muscle pain. But when people have come to me and say, "Hey, I've been having joint pain and I'm fatigued, do you think that could be lupus?" And I'm always like, just go get it ruled out, ask them to run all the tests. And lupus is hard to diagnose because it can mimic so many things. Like, it sometimes people have been misdiagnosed. They say that it's lupus and it turns out not to be lupus because there's certain markers that you have to have in your blood. I can't really think of the exact name. I should have pulled my um
yeah, I do
results,
remember
but
reading
there's
that they
one
called it a
test.
chameleon disease or something like that.
Yeah, absolutely. Yeah, it's hard, and that's why so many people. That's why it takes so long for a lot of people to get an actual lupus diagnosis, is because is, if you don't have, like, I have a friend now that's going through it, and she thinks it's lupus, but the doctors are telling her it's not, because there's, a couple of markers that are not saying, hey, it's definitely lupus, but they are telling her, yes, you have some type of autoimmune disease, but we don't know what it is right now. And so sometimes if you don't have, I don't know. I really don't know how those labs work. I just know that when I got mine back and I compared from when I was first diagnosed to now, I still have this one thing that still shows it's some type of speckle something in my blood that is just there. And when I researched it, that means that that is specific to lupus. So,
So what are some life changes you had to do? Like, did you have to change your diet? Did you have to, from my understanding, like they advise you to stay out the sun, but I know you like the beach. So like, how do you, how do you adapt? How did you have to adapt to a new lifestyle after being in terms of lupus?
well, honestly, when I was first diagnosed, I didn't make any changes, like as far as my diet and lifestyle, because, and it may have been a denial thing. Like, real talk, it could have just been me saying, whatever. Because when I was first diagnosed, it was rough just for a little patch. I just had a patch where I was just, and I think it was just because I was just adjusting to it. Like, this is my new life. This is a part of me now, but it wasn't like as severe as other people that I know, because I used to always feel like, man, whoo, they got it bad, and I'm just dealing with a little joint pain, joint and muscle pain, but I didn't have anything affecting any organs at the time. And so I didn't really make any adjustments. I was just like, well, I just take my prednisone. And when I was on high doses of prednisone, I felt great. Like I feel like Superwoman, honestly, because I didn't have any pain in my joints, and so I feel like I can do a lot of movement. So I just kind of kept doing what I was doing. I didn't eat better. I didn't change my diet. I didn't do any of that initially. So, but if I fast forward to after having a baby, um, it shifted for me. Like my symptoms changed. I started experiencing different things. My organs started being involved, and so um, I don't even now I still don't eat the best, but I have to be careful about the certain foods that I eat. Some things trigger flares. There are some spices or things like that that make me feel tired. I notice when I eat things like soy sauce, things like that, it brings me all the way down, and I think it's the MSG. I really don't know, honestly, but I just started to, keep an eye on what I was eating and consuming, and so being out in the sun, it really does bother me. Like, not while I'm right there in that moment, but coming out from the sun, once I come out of it, like, I'm hurting and I'm really fatigued. Like, those are the main things. Like, I don't have any skin issues. Like a lot of people, they avoid the sun because they have discoid lupus, and so it affects their skin more. And so I don't have the issues where I get some people get knots and big, spots on their arms and faces, all those things. Um, and so they have to stay out of the sun, even with sunscreen. Like we have to wear sunscreen. I wear it even when it's not sunny out because, we're supposed to, but fortunately, I don't experience the discoid part of it to where when I have a flare, it's all over my face and my arms and stuff like that. So,
If it was a scale from 1 to 10, I like one being like not bad at all and 10 being like crazy, like what are you on the lupus scale? There's such a thing. If you had to guess a
like
number.
right now,
Yeah. Or your worst. I don't know.
right now, so I've been at a place where I was at a 10.
Really?
Absolutely. Felt like, yeah. I just felt like it couldn't get any worse. And I don't know if it was just because, and it wasn't so much as me being in pain. It was more of a mental battle after after I got diagnosed with AFib and then found out that it was, from lupus, and then having stomach issues from lupus, all of the things started coming, having to get my esophagus expanded because of inflammation, just all the things that lupus started to affect. It kind of put me in a bad space mentally. And so I feel like it was just really pointless, honestly, to just kind of keep fighting because it was just like every time I feel like, okay, I'm getting better, things are getting better. Then I'll get something else, a new diagnosis. Oh, well, now you have AFib. Oh, now you have gastroparesis. It was just kind of like, oh, now you have protein in your urine. So your kidneys are affected. So it was just kind of like at one time I was being hit with a lot dealing with lupus. And, a lot of people didn't know because, I mean, I don't share a whole lot. I share bits and pieces, but people really don't know all of the aspects of what lupus has done. And so, yeah, I've been at a 10 before.
What year was that? If you got to say, like, you got diagnosed in 2011. So what year was that?
Diagnosed in 20.
Good? You back? We can edit it out.
Okay.
And if you have to leave, use the restroom, whatever, it's all good. But what year was that? You got diagnosed in 2011, and you got to a 10 at what year?
Okay, so I was diagnosed in 2011. I had, I went through a little issues with it a little bit, but never had any hospital stays for lupus. Then I went into what they call remission. Right before I got pregnant. Yes, right before we got pregnant, I went into remission, had a great pregnancy, healthy pregnancy, no issues with lupus, stayed. It was so great that they took me off of being high risk because immediately I was considered a high risk pregnancy because of lupus. But my doctor was like, "You are doing great. We don't need to keep you at high risk." Um, so 2000 and let me see, Parker was born in 2016, close to the end of the middle of 18. So I started having I had a really bad flare. And so my doctors decided that I should start getting Benlysta infusions. And so we tried that for a minute, but I started having more issues with the Benlysta. Like I started getting severe migraines. And then 18 was when I was diagnosed with AFib. And so during that period is when everything really just started hitting me back to back to back. AFib, I had hospital stay. Huh?
Sorry. What's AFib? Like, need to expound on that.
Atrial fibrillation. So it is when the rhythm of your heart is off. So basically, it's just beating fast. And it is not so much as my heart being affected, it's the electrical part of my heart that's off. And so it's shooting out of one of the chambers when it's not supposed to. Basically, one of the parts is firing outside of the chambers, which causes the rhythm to be off. And so I had one bout of AFib. I had an AFib episode in 2018 when we were in LA. And that was really my first hospital stay outside of having a child. I had never been in a hospital.
I remember that y'all went out there for vacation. Like, was it Vegas or Italy, I guess?
And we were in LA. We were in LA for Dante's birthday. I ruined his birthday trip. I tell him all the time. Yeah. We were there for one day. Like we got there, and then next morning we woke up. He went to go work out with his sister. They went to go climb something. I don't know where they were going, to the mountains to hike. I don't know, but before he could be gone 20 minutes, I got up to use the restroom, and my heart felt funny. I had never felt it before. It just felt kind of like it was flopping. Like, that's the way I can describe it. It was just kind of flopping around in my chest. And so I called my mom before I called the ambulance. I said, "Hey, something is going on with my heart." And she was like, "What does it feel like?" I told her what it felt like, and she was like, "That's AFib." Like, I don't know if it's God giving her stuff. Like, she literally tells me every time. And so she was like, "That's AFib. You call 911." Yeah. She was like, "You call 911. I'll call Dante and tell him to come back to the hotel." And so when they got there, I had called her back and we were on FaceTime. And so she was watching, everything, and Dante was on his way back. And so they hooked me up and they said, "Yep, the state field, we got to get you to the hospital." And so I didn't know what it was at the time. I was just scared. And so we got to the hospital, but they couldn't convert me back to normal sinus rhythm quickly. And so they kept giving me doses of medicine trying to convert me back, but it wouldn't work. And so that's when they made the decision to admit me so that I could get it on an IV drip. And so I remember looking at the nurse when they couldn't convert me, when she was like, if we don't get you, if the doctor doesn't order, an IV, we're gonna have to use the thing to shock your heart. What is it? Defibrillator. To shock your heart, yeah, to shock you back. And I was just like, no, ma'am. And I looked at her and I was just like, please don't let me die. Like, I have a baby at home. And I was like, please just don't let me die. And she was like, you're not going to die. It's going to be okay. And I'm all the way in LA. My family is all the way in Arkansas. But we had Dante, y'all's family, come to the hospital while we were there and, look out for us. And his friend Courtney was living in LA at the time, so he came and brought us food and things. And so I didn't even think the doctor was gonna clear me to fly back. Like, I basically had to beg for him to clear me to fly back home. I was like, I just need to get back home to my baby. Like, that's all I was thinking about, was getting back home to her. And so he cleared it and told me I had to go to the doctor like the next day as soon as I got back. And so, yeah.
So when someone is diagnosed, if a young lady is diagnosed, is pregnancy like a challenge, or is that still something that can have a healthy pregnancy, or do you have to be kind of in remission to kind of have a healthy pregnancy?
Well, you can, like I said at the beginning, everybody is different with lupus. So before, I know when we were trying to get pregnant, my gynecologist was saying, some people do great with it and some people don't do good at all. Like, I know people who've gotten pregnant and it almost killed them, because their bodies was just attacking itself so bad with lupus. And so but they continue to have kids, and the doctor kept telling them, "You might want to stop because it's gonna kill you for real." So, but thank God I was fortunate enough to have my doctor said it was just he had never had anybody with lupus that had a pregnancy like that, and so it was just I had absolutely no signs of any inflammation, nothing in my body while I was pregnant, and so like I said, so everybody is just different. And the doctor, I remember him telling me, we might want to keep you pregnant. You want to keep having kids? No, I'm good with one. I'm good.
Sweet Parker said, "Nah, I'm gonna come out healthy." Now she was
Right.
premature. Like, did the lupus affect that, or was that just separate? You don't know.
Well, they never said that it was lupus, but they did tell me that my placenta just died like 3 weeks before she was born. She was getting absolutely nothing. And so when they got the placenta and tested it, they said it was just dead. Like, it just stopped working. So the way I view it is if it was just God just keeping her protected from, lupus. And if my body was about to start tripping again, God was just like, let me go ahead and cut this thing off, because we don't want her to be affected by it. And she was born 2 months early, but she was still very much so healthy. She was just tiny. We had a few little issues with her, but nothing that was like what could have been, especially with her being born so early and so small. And so I'm super thankful that she was not affected by that and she's as healthy and happy as she want to be now. So
Definitely.
yeah.
So let's talk about your support system. I got so much respect for my brother Dante after hearing the story. I did not know the severity of it so early on in the marriage. Like, that takes a lot of maturity out of him. So, but let's talk about your support system. Your mom, Dante, Parker, anybody else. Like, what has that been during this process? Like, how big is that for you to keep going, if that makes sense?
Man, so before Parker, of course, Dante and my mom have literally been my rock through this entire journey. And we've had quite a few ups and downs. And like I said, I don't share everything. Those two have seen everything. And now Parker, because even though I try to shield her from it, because I don't want her traumatized, but um, we have a lot of hard moments inside our home because of lupus. And without them, honestly, I would have given up. That's just the truth. Because like I said earlier, just being hit with so many things back to back to back, like it's like, okay, I'm good, then boom, it's something else. And then, just mentally it starts to weigh on you, and I start feeling like I'm a burden, but just knowing that I have them, um, coming to every appointment, making sure that I'm doing what I'm supposed to do as far as taking my meds, because there was a point where I was just like, I'm gonna stop taking them. I don't care, just, what's the point? It's poison. That's what I was just telling myself. I'm not taking this. It's not making me better. And so, but having them there to like hold my hand, hold my hair when I'm throwing up, just things like that, it just, makes me, really realize how blessed I am. I may not have a million people, that are right here, but the people that are here and that are my support system, really keep me going. And so with Parker, when she was born, that was like the extra push that I needed to fight. It was like, now I got somebody looking at me every single day that doesn't understand. She's just now starting to ask, more questions about it. And but when she was smaller, I would just look at her when I was having really rough days, and it was just something inside of me would be like, nope, get up and fight, girl, because somebody is depending on you. And I have to tell myself, even now, even to this day, I still have to tell myself, I know that God would not bless me with this little miracle for me not to be able to raise her, and so that's what keeps me going. Like, cause when I'm in my feelings, cause I get in them sometimes, when I look around and I see everybody, being able to just enjoy things and not have to deal with. So I can go and enjoy things. Let me just say that. But having to deal with the after fact, once I go and enjoy myself, I have to come back and feel bad, and recover for 5 days because I stayed out in the sun too long, or because I went to a party. Not that I party, but if I do decide to do that, like, even just staying up late sometimes, and just doing little things, it wears me out. And so sometimes I do get it all in my head and in my feelings, but like just knowing that I have a little person now to fight for makes, all the difference. But my support system is like real solid. Um, I don't have to look to a lot of people for support because the few that I have are just that solid. Sometimes when you have a couple people that support you, but you need more because you feel like, oh, but I really don't have to worry about anything between my mom and Dante alone. That's not including like my aunt, and other people that I'm close to, my grandmother, my dad, but those two alone really, really hold me down. Like, so I'm super grateful.
Wow, amazing. Um, you what is what is a flare up? I mean, you mentioned that a few times, like a flare up. Like, what is that? Is that just you're feeling bad, like in layman's terms? Like, is that just you're feeling bad, or you're fatigued, or aching
Mhm.
bones? Like, what is that? Is it all of the
Yeah.
above?
Yeah. So just basically a flare up is just when, so the lupus is, everybody's lupus is not active all the time, right? And so when it becomes active, that's called a flare up. So it's like in those moments, and sometimes flare ups can last a day, a week, months, years. I was in a flare up from the time I had a hysterectomy in 2021 and to up until just recently, like when I'm just now starting to taper off of being on a high dose of prednisone. I was on 20 milligrams of prednisone from 2021 until 23. Like, high dose, because it was that hysterectomy. I don't know what it did. I think it was just the stress of it all just put me in a really bad flare up. And so Um, yeah, it's just some people flare ups are just fatigue, some aches, but like I said earlier, you never know if it's going to attack any of your organs or anything else. So yeah, got to be careful with those.
Well, when I hear you talk, I hope it's not too uh, a bad thought, but when I hear you talk, it kind of, when you say remission and stuff like that, it kind of reminds me of the C word. So, like,
Hmm.
is there a commonality between those two as far as like lifestyle, or is it like totally different? Like, have you ever thought about that?
Yeah, it's not. It's totally different. Because lupus is autoimmune. And so, but people oftentimes think it's the same thing, or it could be, related, but they're not. Now, there are some people, I have myself, who have taken chemo, chemo pills. Like I took methotrexate early on in my diagnosis to try to basically, knock it into remission. And I know people personally who have had to go and have chemo for lupus. So it just depends. But they're not the same. They're completely different. Simply because lupus is autoimmune. So
And so you're able to live a full life as long as you take your treatment. Like there's no, as long as you take your treatment, you're fine basically for the most part.
yeah,
I mean, the
for the
quality of
most
life
part, I
this may
mean,
not be what you want, but you can live to 80
right,
or
right.
85 or
Your
whatever.
quality of life, yeah, you can live for a long time. Taking your meds and going to the doctor, making sure you're following up and doing those appointments. That's very important. I don't think I've ever skipped a lupus, my rheumatologist appointment. There's been a span where I was without a rheumatologist, but my PCP was making sure that I was, my numbers still look good, and he was treating me the best way that he knew how to. He knew a lot about lupus, and so he was able to keep me going. But I've never just skipped because I know how important it is. We have to get labs. Well, I get lab work done every 3 months. Sometimes what it was a time when I was going every month to get labs because it was so active. And they were just trying to watch like the protein and things like that in my urine. So, but yeah, you can live a healthy ish, you know, lifestyle. You can, their life expectancy. I don't even look that up because I don't even know what the books say about that because I know, who is in control of that, so I don't really look to what the doctors say regarding that. My doctor has never told me that I couldn't live a normal life. But there are people who unfortunately, if the lupus attacks their kidneys, sometimes they have to go on dialysis, need a new kidney. Sometimes they may not get it, need a new heart. You know, sometimes lupus can, unfortunately, the what it causes and what it does to our bodies, it can, cause us to pass away. So, like, I think that taking medication and not doing the things that they tell you, not to do, to harm your body any further than it's already beating itself up, I think that you can still live a full life with it for sure.
No, that's awesome. When we was hanging out one time, you mentioned I don't know, and you could share whatever you want to share or don't want to share, but you was mentioning the cost like for the medication. It was like some astronomical number. I want to say 16K or something like that, like every treatment. Um, and I guess your insurance covers it, but like, yeah, talk to me a little bit about that. Like, what is the cost without insurance?
So yeah, right now I do Benlysta infusions every 28 days, and it is about $15,000 per infusion. And yeah, every 28 days. And so, but they do have been listed, the company who makes the medicine, they have a copay program. And so, if you have commercial insurance, you can qualify for that program. And so, I am on the copay assistance program, and my insurance covers a big chunk of it. So, thankfully, I don't have to pay anything out of pocket for that. But at one point, when I was getting the injections, I was having to pay a little bit, but I pay nothing out of pocket for it because what my insurance doesn't cover, the copay assistance covers the rest of it. So, but it is about $15,000. I had a bill somewhere just a minute ago, but it's about. I was looking at it and shaking my head like, my goodness, that is ridiculous. And I do it every 28 days.
Oh my goodness. Wow. All right, let's transition into now. Like, I know you're a woman of faith, so what has that done And how does that affect your outlook on everything? Like just trusting in God, knowing He has the final say. How do you process that when you're dealing with this?
Ooh, that's a hard one. Uh, just being honest and transparent, like somebody asked me one day, "How do you stay so positive?" She just inboxed me one day. She went and was like, I just want to let you know that I really admire your strength, all these things, and you go through a lot, but you're always so positive. How do you stay so positive? And I was like, girl, I'm not this positive all the time. I am positive. I do have a positive outlook most times, but sometimes I be feeling like, okay, God, hey, I'm ready to tap out of this, like, why do I have to keep on going through this stuff? And so, but, my faith and prayers from my people, my support system, my family, those things have really kept me afloat because it has been times, like I said earlier, where I was just like, forget it. But I got a mama that ain't gonna even let me, even when I'm sick, okay? That woman is not gonna let me just lay around and be sick. Like, she'll be like, "Imma give you this day, but tomorrow you getting your butt up and you gonna move out that bed and you gonna come sit on the couch." Like, she is that mama, like, 'cause she does not want me to just be like, "Oh, I just don't feel well." Like, she will not let me just do that because she's like, "If I let you do that, you'll stay there," you know? And so I'm not gonna let you stay in this place. Like, she'll give me my moment, but she is always like, I'm not gonna let you stay in this place. And, there's been times when I'm like, I can't even pray for myself. But thankfully I got a praying husband and a praying mama and a grandmama, that and I know for a fact that their prayers have really pulled me through some times where I didn't even want to be pulled. Like, I'm just like, let me be, leave me alone. I don't want to be bothered. I don't want to deal with this no more. I don't want to talk about it. Y'all don't understand, just going through a whole gamut. And I'm like, y'all don't get it. Y'all don't understand. You don't have lupus, you don't get it. Just doing all those things, but where I wasn't even praying, I wasn't talking to God. You know what I'm saying? I'm like, I'm mad at him, mad at Dante, mad at my mama, I'm mad at everybody, because I feel like, and I'll be like, now y'all healthy. Now don't bother me because y'all are healthy. So let me be. Let me be. So, but yeah, I thank God that I was raised, with the word and I know the word. And so I know where my help really comes from. I have a wonderful support system, but I do know that if I didn't have them, I still know where my help comes from. So, and I know there's times when I'm like, I'm too weak. I can't do this. But somewhere, God gives me that strength to keep going. And so I trust him wholeheartedly, for real.
That's amazing. Now, how does this impact your outlook on life? Like, does lupus take up all of your prayer requests, or do you still, you know, pray about finances or opportunities, or is it just like lupus is everything? Or do you suppress it? Like, I know this is part of my life, but this is not going to prevent me from pursuing this. Like, how do you navigate those things? That makes sense.
Sometimes it can be hard. Like if I'm so for instance, if I'm presented with an opportunity, um, lupus always comes to the forefront of my mind. And I'm always thinking, can I even do this? Like, am I gonna be physically able to even do this? And then mentally, because I do know that stress is the number one cause of a lupus flare. So and it doesn't even matter if it's good stress or bad stress. I could be like, for instance, planning when we were planning our wedding. That wasn't a bad stress. That was a happy time. We are about to have this beautiful ceremony, all the things, but my body was stressed. And so it brought on all the symptoms. Everything just came out. And so even when I have good stress, it's a lot. And so that always comes to the forefront. I'm like, okay, can I do this? Even right now with school counseling, with my current job, last year I had so many hospital stays. I literally questioned if I was doing the right thing because before I enrolled in school, I had enrolled in grad school several times before this last time in 2020, but every time I would get started, I would get sick and have to quit. And so this last time I was like, okay, God, if I do not let me get accepted into this program, if I'm gonna have to quit, if I'm gonna have to stop, I don't want you, I just don't let me get accepted because I don't want to quit. Like I really want to do this. And so when I got accepted, I was like, okay, so that means you're gonna keep me well, you know? So and so, but I did get sick at the end of the program. I finished it off in the hospital, basically. I was in and out of the hospital. I had surgeries and all the things. And so, but I finished the program still. But when I got this past year, I've had several hospital stays, more than I like to even count, because it really put me in a bad space. Because I was like, dang, I got a job, I'm working in my career, and now I'm in and out the hospital. And so I started to really be questioning, like, okay, is this something that I'm supposed to be doing, but I know it is, because I just, he's told me that. And so I know that's where I'm supposed to be for this season. But my prayers aren't really concerned with lupus. To be honest with you, I don't even really pray about my health like that anymore. Um, because I kind of feel like you already know what's going on. So, what I desire, but I just don't feel like I don't want to make that the most important thing in my prayer life. However, like I said, it does come to the forefront when things are presented to me. I am always like, oh, can I do this? But I never really just go into this really deep prayer zone specifically for that. Now, when I am in the hospital, of course, I pray, that I can get out, be healthy, come home, and be with my family. But my everyday prayers, no. But Parker's everyday prayer, every single night, every night, the girl prays for me to be healed, for me and everybody else in the world with lupus to be healed. And so, maybe that's why I don't pray for her so much, because that's the girl's she's gonna make sure she throw that in every night. But I still pray for everything else. I pray for our marriage, our finances, other people. I honestly pray for other people more than I pray for myself.
We're about to close, but I really appreciate this time. And I know you had to go through a lot to even make this happen. We was going to do it last week. And I guess you had the flares and stuff. And so I have so much more understanding about this disease now. And I definitely be praying for you and praying that you'll be able to continue to enjoy life and things like that.